The last one that want to talk about that you offer in your office here is dry needling.
Yes.
And that just sounds like you're turning someone into a giant pincushion.
Pretty much, yeah.
And why would we do this?
You know what, so this is a really hot button topic right now. You know, I'm one of the few chiropractors in the Valley that do this. Quite a couple handfuls of physical therapists that I know that do this as well. But getting a lot of attention as of late, just because the benefits and the results that we're getting. You know, the one thing with this that I do want to talk about briefly is just how it's different from acupuncture, because it is not acupuncture. I'm not a licensed acupuncturist. Acupuncture is more with the Eastern traditional medicine. They deal with meridians and things like that. Very viable, very useful, you know, treatment modality, but not what we're doing here.
So not acupuncture.
Not acupuncture. The tool is similar, but what we're really trying to do is go into trigger points, decrease pain, improve range of motion. By getting blood flow to a tight area and then just releasing a lot of those muscles that are bound up tight and in knots. You know, a specific area would be in the traps. You know, everybody's got tightness up there. Very, very beneficial, very effective, and quick at that. You know, it doesn't take 25 sessions to do something like this. This is usually 3 or 4, and we're seeing a really good result for people, you know, on the pain and on the range of motion type thing. So, you know, in the acute injury setting, this works fantastic for those, you know, calf strains, hamstring strains, but also see it work well in tendon injuries. You know, things like Achilles, plantar fasciitis, which are very difficult to treat.
Tennis elbow,
everything like that, where you're seeing that overuse type injury where the tendon's not getting a lot of blood flow, not allowing it to heal. That's one really beneficial, effective way to treat those things.
So what is it? You stick the needle in.
Essentially, yeah, it's very small, but you know, we'll find when muscles get tight chronically, they're very ropey, and you can feel it. And what we do, and what's really nice about that, is we can be very pinpoint on what we're trying to do. Right, so we can find the specific muscle or the bands within the muscles just through palpation and say, okay, you know what, this is very tight, let's treat that. And what I really like about dry needling is most people have had E-stim. You've had patches on you, and it just kind of gets this whole area to contract.
Like a TENS unit.
Pretty much, yeah, like a TENS unit. With the needles, we can do more of like an inside out. We can put the needles in, we can find the muscles that are tight that we specifically want to treat, and we can put a current through that. Ran over and grabbed the TENS unit, but basically we would hook up leads from this and attach them to the needles that are in the tissue and basically put a current through that and still get that contraction that you're used to with the TENS unit, but it allows us to be more specific.
So it's kind of the best hybrid of both worlds between like electrical stimulation and acupuncture, because you're still getting that needle in there, but now we're targeting a specific aspect, not just the whole range of muscle.
Absolutely.
So what type of results are you seeing?
So, you know, one thing when I first started needling, because not everybody loves needles, let's just be honest.
I don't.
I would reserve it for like a 3rd or 4th treatment when somebody wasn't coming around. And then just once I started doing that clinically, I saw everything from IT band issues, Achilles tendinopathies, you know, hamstring strains, all of those things that are difficult to treat coming around really quick. And I'm like, you know what, I'm going to start doing that first treatment. You know, regardless actually of how you feel about needles, we're going to do this because it gets you in and out of here as fast as we can. You're going to get better results, and you're going to get back to the things that you enjoy faster. So when you look at those chronic injuries or even acute ones, the turnaround of how people are coming about or healing is a lot faster. They're feeling those muscles loosen up a lot better. They can get back to normal range of motion and start getting that activity that we know is what really helps us heal.
Awesome.
So.